good morning, social media family. Good afternoon, good evening, wherever you are. My name is Dr. Rosemonda Boaje of RAN Medical Imaging and Health Systems. And today I come your way once again with a series on breast cancer. Today we are talking about the symptoms of breast cancer. So generally, breast cancer is not symptomatic. You shouldn't feel anything for most people who have breast cancer. The moment you have symptoms, the moment you can feel or see changes, then it is most likely that the disease is advanced. That is why we emphasize the importance of screening for breast cancer, because long before we see changes, the early signs of breast cancer can be picked up on mammogram or ultrasound. So therefore, if you are a woman 40 plus, every year, please have your mammograms. If you are less than 40, have an ultrasound. If you have a first degree relative, that is a sibling, a sister, or a brother, because men can also get breast cancer. If you have a mother or father, or if you have a child who has breast cancer, then you need to even start screening earlier. At whatever age your first degree relative had the breast cancer, you need to start screening 10 years before that age. So for example, if your mother had breast cancer at 40 years, you would have to start screening at 30 years. Please take screening seriously so that in case, per chance, we pray it doesn't happen, but should you get breast cancer, we can catch it very early and your chances at total cure and a long fulfilled life is optimized. So what are some of the signs and symptoms of breast cancer? So normally you know that our breast is quite symmetric. They are supposed to be very similar in size and in shape. Anytime you are doing your self-breast examination, one of the things we ask you to do is to stand in front of a mirror or to use your phone like you are taking a video and look at your breast, look at the symmetry. For most women, one breast is usually a little bigger than the other. But when you look in the mirror, it shouldn't be very obvious. They should look the same. They should be pointing in the same direction. I mean, the nipples. Once there is a difference in the way they look, you should be concerned and probe a little further. Sometimes you would feel a thick area in one of your breasts, a small area where the skin is a bit thickened and it does not go away for several days. You should be concerned about changes like that. You know, some women have dimples where when they smile, the cheek goes in a little bit. And sometimes that can happen to your breast. You have dimpling of the breast where part of the breast is tilted inwards, like a dimple, like you are seeing on the screen. When your breast has that kind of change, you should be concerned. A few times you may have crusting around your nipple, you may have skin changes, and then you have this discharge that is always dried up whenever you expose your breast. You should be concerned about these nipple crusts, especially when it comes to a particular kind of breast cancer called Paget's disease of the breast. Sometimes the skin has discoloration, especially for those of you who are fair. You realize that part of the skin, the color has changed. It has become a bit darker or it is looking a bit reddish. Anytime there's a change in the color of the skin, you should be concerned. Sometimes the whole breast or most of the breast, the skin, looks like the skin of an orange. It is thickened and has several tiny dimples like the skin of an orange. We call that pousse orange. Anytime you have this pousse orange appearance of your breast, you should be concerned. Sometimes you may feel a lump. Most of the time, the lumps that come with breast cancer are painless. It may be one, it may be multiple, but typically it's one. It is painless. It's usually not mobile. And in addition, you may have a few lumps or nodules in the armpit of the breast that has been involved. One of the other things that can happen to your nipple is that it kind of pulls in. We call that an inverted nipple. There are some people who naturally have inverted nipples, and typically it is bilateral and their nipples have always been like that. But if you are the kind who had a regular nipple that points out, and then suddenly you realize that one has started to retract inwards, then you should be concerned. That is called retracted nipple, and it is one of the symptoms of breast cancer that we are not happy to see. Sometimes you may have a breast discharge. Breast nipple discharges are very common, and they are usually related to a lot of benign or non-breast cancer related issues, developing breast infections, cysts in the breast when you are pregnant or when you are breastfeeding. Sometimes when you are very sexually aroused, you may have nipple discharge, injury to your breast, stress from any kind of external stimulus at all. When you have some kind of medications, including some birth control pills and some antidepressants, these can make you have nipple discharge. No matter the kind of discharge you have, you should let your doctor take a look and clear you that everything is okay before you sit back and rest easy. But generally, when the nipple discharge is clear, yellow, green, brown, or white, most of the time we are not too concerned. We are particularly concerned when it is bloody or pinkish in color. But for whatever kind of discharge you have, come, let's check you out first. When the discharge is from both breasts, we are not too worried. But when it is coming from just one breast, we tend to be very worried about it. If the nipple discharge only occurs after you have squeezed or stimulated the nipple, we are not too concerned. Or if it is coming from several ducts at the same time, when you squeeze it, you realize that there are different tiny points where the discharge is coming out. Those are usually not of concern. But when the discharge is coming from one breast, comes out by itself without you squeezing or playing with the nipple, or when it is accompanied by other symptoms like breast pain, redness, swelling, and changes to your nipple, you should be very concerned. The last symptom about breast cancer that I would want to talk about is skin sores. Sometimes the breast cancer can build up for so long that it gets to a point that it breaks down the skin to form an open wound. And invariably, for most people, this open wound becomes infected. It doesn't go away. It gets a very bad smell, and it continues to leak fluid or pus. And usually, apart from the sore, you realize that there's an obvious hard lump in the breast. When you get to this stage, then it is most likely very advanced breast cancer. That is what we do not want to see. In the past, and I think it's still happening now, most of the time, by the time our women, our sisters, our mothers, they come in, they are at that stage because they are afraid. They say that when they come to the hospital with breast cancer, we are going to cut off their breast. A lot of people have been told that once you are diagnosed with breast cancer and they take off the breast, the next thing is that you are going to die. That is not the next thing. People die because they come when it is too late. And that is why, once again, we are emphasizing on the need to screen. Let's pick it up before you can see it, before you can feel it. Be on the lookout. Feel your breast. If you are a man who loves a woman, you are with your wife, you are with your spouse, your partner, feel the breast. And when you find a change, let her come. There have been instances when the men have been the ones who have picked up the changes. So guys, help us. Help save the women. Breast cancer is real. Let's take it serious. I love you all. God bless us.
We shall